Welcome to Savitha Dental College lecturecast in Prosthodontics, Jaw Relation Part 4. Here we are going to discuss about orientation jaw relation, which is basically recording the angulation of the maxilla to the base of the skull. It is done with the help of a face bow, and there are two types of face bows, kinematic face bows and arbitrary face bows. Arbitrary face bows are the ones which record the orientation jaw relation, whereas kinematic face bows can only record the true hinge axis. So even if we use a kinematic face bow to determine the true hinge axis, we will require an arbitrary face bow. Arbitrary face bows can be further subclassified into earpiece type and fascia type. As you can see in the image below, earpiece type would get inserted onto the external auditory meatus, whereas a fascia type face bow, the posterior part of the face bow would only go to a point in front of the tragus of the ear. This point can be determined as 5 mm in front and 5 mm below the canthotragal line. Next, let's look at the procedure for recording a face bow transfer. So the first step is to use the bite fork of a face bow and load it with impression compound. So the bite fork is a part of the face bow that is inserted into the patient's mouth, and the patient will record their bite on it. So as the material is soft and evenly loaded, it should be inserted with gentle pressure. Care should be taken not to expose the metal parts on the teeth. So you should not apply too much pressure. And you should also make sure that the stem of the bite fork is exactly at the midline of the patient's head, as shown in this figure. Once the material is set, it should be washed and excess should be removed, such that only the cusp tip indentations are there. This is done so that there is no interference in reseating the bite fork while doing the face bow transfer. So we can use a BP blade to cut off the excess, and the final cut process you will see only the indentations of the cusp tips. Now once the bite fork with the impression compound record or the bite record has been fabricated, it should be placed back in the patient's mouth and stabilized with the help of cotton rolls. So care should be taken to avoid rocking the plate. It should fit perfectly well, and the patient should be able to bite into the bite fork with the help of cotton and keep it in stable place. So if this is still not stable, you can use additional manual assistance to hold it in place. So the next step would be to insert the face bow onto the bite fork. So the bite fork, as you can see, has a U-shaped frame and a vertical rod and a transfer assembly. So as a practitioner is doing, you can see that they are inserting the stem of the bite fork into the transfer assembly, and then the patient is widening the U-shaped frame and inserting it onto the external auditory meatus, and she's holding it with her fingers. Now the operator will position the level of the U-shaped frame and then adjust the anti-reference point, which in this case is an ASION. Based on the brand of the face bow, the anti-reference points can vary. For example, this is a Whipmix face bow, whereas Hano face bows will have the orbital as the anterior reference point. So now the nasion is pushed tight and then it's tied together, the anti-reference point, and you can see that it will literally pull the face bow forward. Next, the U-shaped frame is also tied together, and the midline is verified, and then you can see that the operator is tightening the bite fork to the transfer assembly. So finally, once the face bow transfer is done and all the adjustments are tightened, it should be verified if it is parallel to the, it's exactly at the midline, the bite fork should be at the midline. If it is deviated, the face bow transfer is wrong and we'll have to repeat the record. And the U-shaped frame should be parallel to the interpupillary line. So to remove the face bow, we'll have to loosen the anti-reference point, which is an ASION, and open up the U-shaped frame. So once the frames open up, the patient needs to relax and you get the whole record. You can see the bite and the base of the skull plane recorded together, and that completes orientation jaw relation. Thank you.